Hours after Joe Biden was sworn into the presidency, he was preparing to sign several executive orders, including a handful to address the COVID-19 pandemic.
We've come so far, but we still have far to go.
One order would create the COVID-19 Response Coordinator, a position being filled by Jeff Zients to oversee the White House's handling of the pandemic. Another would reverse the United States' withdrawal from the World Health Organization. A third would institute a mask mandate on federal property. Biden has urged people to wear masks for the first 100 days of his presidency, arguing that it isn't a political statement as the COVID-19 pandemic worsens. He is also expected to use executive power heavily over the next week and a half. He is expected to reverse the so-called Mexico City policy, which prohibits international aid to non-governmental organizations that perform or promote abortions outside of the U.S. The policy has traditionally been in place during every Republican administration since Ronald Reagan's presidency. The incoming administration is also likely to reverse many of the previous administration's regulations around the 2010 healthcare law, known as the Affordable Care Act. While the Trump administration sought to weaken the law, Biden campaigned on expanding it. He could use his regulatory powers, as well as an office known as the Centers for Medicare and Medicaid Innovation, created by the ACA to build on the law, particularly if Congress does not or cannot advance certain healthcare priorities. On Thursday, Biden is going to sign 10 more executive orders or presidential directives. These orders would expand use of the Defense Production Act to produce more medical supplies and vaccines, create a national testing board to increase testing availability, and provide more guidance for how to reopen schools and for employers to protect workers, among other things. The Biden administration is also going to create a panel focused on health equity to address the racial and ethnic disparities in healthcare that have been highlighted by the pandemic.